admissions that we are having at KMTC.
Yeah.
We advertised last time and we only needed about 12,000 as newcomers. But we got applications for over 40,000. Therefore, that shows how lucrative and how more and more people really want to get into the profession. And for us, it is to ensure that we have the right policies, we have the right tools to ensure that we train the right cadres for the masses. I'll give an example. When you look at the accidents that are happening on the roads, sometimes through motorcycles, sometimes you're knocked by and right next there's a health facility that may not have a qualified staff to treat that kind of a person, even trauma, even as basic as mental health issues, which is which has become a big issue in our society today. Therefore, we will need to keep training these specialized cadres to ensure that we take care of the masses at whatever level.
Okay. Is the country's, healthcare system sufficiently equipped to allow the government to send out nurses?
In terms of employment?
Yes, yes.
We have said that we already are producing enough graduates every year. And this is to ensure that we absorb them locally, and the ones that are over, maybe we have excess, we can send them abroad. And sometimes you don't have to force people to work either locally or abroad. It's a choice for a person.
Perhaps they're going...
So for us as government, we continue looking at the gaps. And when I started, I told you that we have already done an assessment of all the levels in our health facilities. So we know the gaps, we know what we need. What we are doing right now is costing. Because we can't just wake up one day and say, send 10,000 health workers, health workers to maybe West Pokot or to Mombasa. We are doing the costing to know how many we require in every health facility. How much will it cost the government? How much equipment do we require in a certain health facility? How much will it cost the government? Where there's no plan or structure, we are bound to fail.
Okay.
Now we have a plan, we have a structure. For us, it is to implement that which we have already done. Therefore, in due course, I will come and we discuss that aspect.
Yes.
And I'll give you even the figures and the time frames.
Because perhaps they could be going to look for better pay. Are you perhaps looking forward to standardizing and matching?
These are conversations that we can have every now and then, really, on improvement of pay for health workers, really. It's a conversation that is continuous. Since right now we are working on their CBAs, then I'm sure that one will come up.
Madam PS, we are entering the home stretch because of time. We thank you for your, wonderful time to be able